Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
Welcome to the deep dive. Today we're digging into something I think many of you grapple with, that tricky balance between the medical model structure and the more, let's say, heart-centered side of mental health work.
Right. Especially for those of us practicing at the master's level, it's this constant question, isn't it? How much weight do we give a formal diagnosis, like from the DSM, versus, really honoring the person's lived experience right there in the room?
Exactly. It can feel like walking a tightrope sometimes. And that's where Dr. Michael Jones's ideas come in handy. He has this great metaphor, the chocolate milk one.
Ah, yes. I like that one.
Yeah, me too. So the idea is the milk is the structure, think assessments, diagnosis, treatment plans, all that necessary framework. And the chocolate, that's the heart work. It's the metaphors, the stories, the human connection itself.
For richness.
Precisely. And Dr. Jones argues quite convincingly, I think, that you really need both for the best therapeutic work. So that's what we're diving into today, how to mix that metaphorical chocolate milk effectively.
And it's important because, let's face it, clients often walk in already aware of diagnostic labels, maybe even carrying some from previous experiences. So the question for us becomes, how do we navigate that thoughtfully?
Right. Which brings us to this idea of diagnosis as a framework, not fate. Dr. Jones puts it nicely. The diagnosis only becomes a label if we treat it as such. It's a lens, not a cage. I find that really shifts the perspective.
It really does. It moves it from being this fixed, defining thing to more of a tool for understanding. And he shares this story about a student, which I think will resonate. Yeah, a student grappling with a really complex case. Trauma, dissociation, anxiety, all tangled up.
Sounds familiar.
Right. And the student felt this pull, wanting to see the whole person, all that complexity, but also feeling the pressure to, land on a diagnosis.
Oh, absolutely. That tension between honoring the nuance and needing some kind of clinical handle on things, I think every practitioner feels that, especially early on.
Definitely. And this is where Dr. Jones introduces the idea of parsimonious diagnosis.
Parsimonious, meaning like keeping it simple.
Essentially, yeah.
Yeah.
Not ignoring the complexity, but finding the primary diagnosis that kind of captures the core struggle. His example was PTSD.
Okay.
How PTSD could potentially act as an umbrella. It can encompass related symptoms like anxiety or depressive feelings without needing 3 separate labels necessarily.
So instead of listing everything, you find the main driver, the thing that helps organize the treatment approach most clearly.
Exactly. Because as he points out, sometimes listing too many diagnoses can actually muddy the waters.
Right. It could lead to a treatment plan that feels kind of all over the place.
Yeah, potentially scattered, maybe less focused, which ultimately might not be the most helpful path for the client.
Okay, so we've talked about diagnosis as the milk, the structure, the lens. Now let's get back to that chocolate, the heart stuff. Dr. Jones really emphasizes that the best work happens when you blend them, right?
Absolutely. It's not an either. It's about seeing the value in both. The structure assessments, diagnosis, evidence-based approaches, that's crucial. But so is the relational side. The empathy, understanding the client's unique story, building that strong alliance, that's the chocolate that makes it rich.
It's about synergy, really, not keeping them separate. And this idea even applies to how we track progress, doesn't it? It's not just about checking boxes on assessment forms.
Not at all. Those formal measures, they give us valuable data, absolutely. But Dr. Jones highlights paying attention to the qualitative shifts, too.
Like what?
Well, he has this really insightful method he watches for. He tracks progress partly by noticing when clients start using their own metaphors in session, spontaneously.
Oh, that's interesting. Like they start creating their own symbolic language for their experience.
Exactly. It suggests something deeper is clicking,
Yeah.
A level of internal understanding and ownership. They're not just processing what we offer, they're articulating their inner world in their own terms.
Wow. That feels like a really powerful marker of growth.
It really is. It shows the therapy is resonating personally. So he encourages us, document the assessment scores, yes, but also make note of these moments, these meaningful connections, these sparks of insight, their progress too.
So bringing this all together,
Yeah.
how does this balance play out in the nitty-gritty of actually creating a treatment plan? What does Dr. Jones suggest we keep in mind?
Clarity is huge for him.
Yeah.
And actionability. Basically, can the client actually understand and use this plan?
Right, not just clinical jargon that makes sense to us.
Exactly. He warns against getting lost in abstract theory. The key question he poses is, can the client understand and engage with this? It's such a practical check.
Yeah, it keeps the focus squarely on the person we're helping, avoids making it just an intellectual exercise for us.
Totally. And he gives a really down-to-earth example. Say you have a client with significant depression, really struggling to even get out of bed. A practical plan wouldn't just say address depressive symptoms. It would have concrete, measurable goals like, okay, maybe showering 3 times this week, or taking a 5-minute walk each day.
Things that represent actual, tangible changes in their daily life.
Precisely. It grounds the whole process in lived reality, moving from abstract concepts to achievable steps.
That makes so much sense. It's practical.
And he has this personal test he uses for his own plans, which I love. He says, if I can't explain my treatment plan to myself clearly, it's too convoluted.
That's a good one. A really honest self-check.
Isn't it? It just hammers home the need for simplicity and directness. If we can't articulate it simply, how can we expect our client to grasp it and feel motivated by it?
Absolutely. It puts the responsibility back on us, to be clear.
And finally, there's a point of validation he offers that I think is really important, especially if you're maybe newer to the field. He emphasizes that feeling of struggle we sometimes have navigating these complexities.
Yeah.
The diagnosis versus the person, the structure versus the heart. That's not a sign you're doing it wrong.
Oh, that's good to hear. Because it can feel overwhelming.
Right. He says it's actually a sign of deep engagement. It shows you're really wrestling with the work, that you're growing as a practitioner.
So don't shy away from that feeling of tension.
Exactly.
Yeah.
He encourages us to actually live into that tension between the medical model and the person-centered approach. Don't try to necessarily resolve it perfectly because it's in that space, that sort of pause, that tension, as he calls it, that the deepest learning and understanding often happen.
So wrapping up this deep dive then, the big takeaway feels like finding your own way to blend these elements, consciously integrating the structure, the milk, with the human connection, the chocolate.
Yeah. It's about being thoughtful and intentional in how you bring both to your work with clients. And Dr. Jones sums it up beautifully, I think. He says, the work we do is as much art as science. It's about bringing the best milk and the richest chocolate together.
That really captures it, a perfect blend. So for all of you listening, especially those of you honing your skills at the master's level, here's something to chew on. How are you currently weaving together the structured frameworks and the deep human connection in your treatment planning? And maybe, what's just one small, intentional shift you could make this week to enrich that balance even further in your practice? Definitely something worth reflecting on.